a trial site yesterday with a full mobile unit for drive-through with full PPE. We had a lot of kinks in the system, as you can expect. That's why we do a test before we go out into the field. Don't expect these to be 100% perfect the moment they come. They're going to be adapted to the state and the local situation, but we're very confident that these will add testing to the already very robust healthcare system and commercial system. Thank you, Mr. President.
Thank you, Admiral. And this has never been done before, and it sets a great roadmap for future. Should we have something like this in the future? I hope we don't. But it's never been done before, and they've done an incredible job. And again, we're working with the states and relying on the states. We have to, because they have, it's point of sale, it's point of sight, and we're in, I think, just about every instance getting along really well with the states. If I could, Dr. Brooks, if you could say a couple of words, please.
Great, thank you, Mr. President. So I think what you've been hearing from us is to find solutions that are high quality and sustainable based on the frontline workers and governors' requests. And those come in on the governor's call. We've been immediately responsive to those. And that's the level of red tape and bureaucracy that we have removed. I think that point about sustainability and quality is very important because, as the president says, we're creating a roadmap for a different level of functionality for future pandemics. Our flu pandemic preparedness plan was a plan. Now we're seeing where we have to revise, where we have to create new avenues of research, new avenues of work to really ensure that the need of the American people can be reached. We were adamant about having a high quality test based on our commercial vendors. Over the next few months, you will begin to see that other tests that were utilized around the world were not of the same quality, resulting in false positives and potentially false negatives. These tests were studied by the FDA to really ensure that they are that level of quality. And we've given the states the permission to ensure that same level of quality. Now, I want to just say 1 minute on the testing. Testing should not be used as an assessment of your risk. We are asking every single American, no matter what your generation, from Z and up to X and millennials in between, to really ensure that you're following these guidelines. We hear every night of people who are not in work, moving that time into bars and other areas of large gatherings. If we continue with that process, we will fail in containing this virus. So every single generation has a role to play. We're asking our older generation to stay in their homes. And we're asking the younger generations to support them in social contacting through videos and other Skype type functions, or just the simple telephone. We're asking the younger generations to stop going out in public places, to bars and restaurants, and spreading asymptomatic virus onto countertops and knobs and grocery stores and grocery carts. I heard an innovation last night and this morning again on the news. I really want to applaud the private sector who are now creating senior-only shopping times. I think that's extraordinary. I think that shows what America brings. And I think other countries will learn from us about how to really protect seniors in this type of way. I'm hoping that carries through to next year when we have our flu epidemic, where we can really have a very different profile of the amount of mortality that we have during flu that we never talk about. Anywhere from 15,000 to 45,000 individuals are lost every year. If we learn how to do this well and sustain some of those core changes, we can change the way respiratory viruses, not only for this, but the future, affect Americans.
It's a big thing.
A question on the clinical data. So we've had now roughly 5,000 people test positive. We've had 90 deaths or so. When are we going to know the data of who those people are? Who has been infected, what the ages are, what the pre-existing conditions are, how serious it was, both for those who have been tested positive, but also those who have died.
Well, you are singing my sheet of music. I'm very data oriented, so thank you for bringing up this issue of data. I really want to applaud HHS. We had a discussion about this several days ago. They've made calls into Seattle and California to really understand that And also importantly, to understand how many of their patients needed ventilators, how many of them needed oxygen support, how many of them needed and what they needed. Could we predict early someone who was going to have a more difficult course? These are all the questions we're asking and answering right now. We did get an early report back from Santa Clara and Seattle. We're digesting it. We just got it this morning. We're looking at that carefully because we think that roadmap is very important to other communities. We have not discussed this with New York yet. We do know from other countries, and that all is available online, that profile. You can see that mortality under 30 is extraordinarily low. The mortality across the board outside of Wuhan is now settling somewhere around 0.7, but that should not be reassuring because it's much higher in people with pre-existing medical conditions, even if young, and people that are older with pre-existing medical conditions. And so we still want every American focused on doing what they can do today to change the course of this pandemic.
Will you commit to making that data public so we will all know?
We're committed not only to making it public, but to have a website that everyone can see in real time.
Dr. Burks, if I could just follow up. You all are signaling a much more aggressive posture toward containment mitigation now. And many states have been very aggressive, but there is a small number of states that have not issued public guidance to their residents. Is it important for the success of the effort that 100% of the states be forward-leaning on this? And if so, Mr. President, what would be your message to those states that have not?
Okay.
So that's why the Vice President and the President yesterday issued those critical guidelines. As I said this morning on Fox and Friends, you can look at them as guidelines, you can look at them as requirements, and you can look at them as the president asking every American in every state to follow those. That's why we put them out at the federal level. We wanted to make sure every American knew what they could do today to change the course of this epidemic. I think it's empowering. I think it says all of us have a social responsibility to each other, and that's why we believe that every mayor and every governor should be instituting these guidelines that came from the White House and the President of the United States.
And we've been very tough in those states. I know exactly who you're talking about. We've been very tough in them. Thank you. Please, go ahead.
A follow-up question on the testing. You've been telling us for days now that millions of tests have been sent out. So why have fewer than 60,000 people actually been tested?
I think you will see different numbers this week. You heard just at 8,000. Remember, all of these tests, the high-speed tests, were approved last Friday night, and last Thursday night. I think if I could talk to Thermo Fisher and the other groups that have these platforms out there, do not rely on a pull technology, push out those tests. Because we can only make them available. Groups have to order them. So we've been talking to Thermo Fisher, one of the key platforms, to push out tests based on need and not wait for orders.
And is that where the issue is, getting the tests out, or is it getting the tests conducted?
That's a great question. I know part of it is getting the test out right now. I think the Admiral and others are working on getting the issues related to getting the test conducted. Obviously, that does take time. He is working on innovative solutions that are creative and sustainable that will be a game changer in testing, but we don't have the data yet. This is a critical comparator. Can you do it yourself? Can you actually sample yourself? These are the kinds of things we're working on right now, and he's getting the data for us.
And the states are actually doing a lot of it. The governors and the states are doing a lot of it with even our tests. Yeah, go ahead. Go ahead. Please.
Okay, thank you. Can you give us a sense of how long these tough new restrictions will need to be in place until we start to see the rate of this virus going down? And also, can you speak to this study that as many as 2.2 million people in the United States could die if there weren't this type of action by the government taken? To what extent did that prompt what we saw yesterday?
I think, models are models, and they're based on input, and they're based on infectiousness without any controls. I can tell you we've never seen that level of infections that modeled up to that 2.2 million in mortality. So we are looking at that. We are having a particularly model meeting tomorrow. I think that's really going to be important. I've dealt with a lot of modelers in my time. They're wonderful people. but they all have their favorite inputs and they all have their favorite integration functions. So we're evaluating all of those so we can integrate and create the best model for the United States based on the best data. And that first set of recommendations you saw were based on what we could do today to prevent anything that looks like that. If I could just say one other thing to the hospitals and dentists out there. Things that don't need to be done over the next 2 weeks, don't get it done. If you're a person with an elective surgery, you don't want to go into a hospital right now. There's a lot of distraction. There's a lot of people doing a lot of other things to save people's lives. So let's all be responsible and cancel things that we can cancel to really free up hospital beds and space. And then let's do everything that we can to ensure that we don't need the ventilators because we protected the people who would have needed to use them.
And are you looking at the possibility of more actions like, for example, limiting travel within the United States? Are you looking
It's
at
possible. It's possible. We'll see how it goes. I think there's been great cooperation with local governments, states. We'll see how it goes. It's going right now pretty well. Yeah, please, go
Can I
ahead.
follow on that, Mr. President,
Please,
very quickly?
yeah.
Just very
Go ahead.
quickly. Do you need to invoke the Defense Production Act to get more of those medical supplies to different hospitals?
Well, we're able to do that if we have to. Right now, we haven't had to, but it's certainly ready. If I want it, we can do it very quickly. We've studied it very closely over 2 weeks ago, actually. We'll make that decision pretty quickly if we need it. We hope we don't need it. It's a big step.
Need more help from the federal government
Well,
when it comes to those supplies.
You know, when you say
What
the
do to
states,
those
in
governors?
particular, 3 states need some help. And some states, have 2 people, 3 people, no people in the case of, again, West Virginia. So we're looking at it very closely. We've taken it apart 15 different ways. It's a very difficult thing to do. It's a very big step. And if we need that step, we'll take it. Okay?
Quick follow on Kristen's first question. A lot of people have got travel to places that aren't considered hotspots,
Yeah.
Caribbean, Mexico, that sort of thing over the next few weeks. Would you recommend that they follow through with those plans?
I would just say enjoy your home stay. I would just say right now, we have to get this problem fixed, and then we'll get back into business really quick. We'll open up our country. We'll open up our society. The world will hopefully open up. We see areas of the world that haven't done well, and we see areas that are doing very well. And I would put us in the category of doing very well for a country so big. I think that I would recommend that they just enjoy their living room. John. Yeah, go ahead, please.
What do you say to people who are not heeding these guidelines from the White House? And then also I have a question on asymptomatic people,
Yeah, sure.
Dr.
I'm
Burks.
not happy with those people if they're not. But those people are being shouted down by other people. They know it. They're being. It's almost like self-policing. The people went in. There are a couple of instances, I guess, probably more than a couple, where people are not happy when they see others doing what they're not supposed to be doing. We have to get rid of this. We have to win this war, and ideally quickly, because the longer it takes, it's not a good situation. And I'm not even talking about the economy. I'm talking about the lives of a lot of people. Yeah, please. Did you have one?
Will the White House put any restrictions on corporate bonuses for companies that do get bailed out like airlines?
I'm going to ask, I think I'm going to ask Mike, answer that question.
I think it's all a work in progress. What President Trump has made clear to industries around the country is that we're going to do whatever it takes. We understand this is an extraordinary moment in the life of our nation. It's the reason why the president brought in leaders of the financial sector, airline industry. He'll meet with all additional industry leaders today in tourism and hospitality. But he has tasked the Secretary of the Treasury to work with members of Congress in both parties to make sure that we construct the kind of economic support that will allow those industries to weather the period of the coronavirus and then to come back stronger than ever before.
Question for Dr.
We've had such incredible, I don't know, it's almost the word spirit is the best word. It's like a spirit. The banks have come in and the banks are doing things that they would have never done. They're working on extensions and lots of things that they wouldn't have done. Co-pays with regard to the insurance companies. I mean, for them to be doing what they're doing, all about the co-pays, they would have never done that. And they did it. They were in my office. I would say the 11 biggest in this country. I guess probably the 11 biggest in the world, the big ones, all the big ones, and they did things on copay that nobody would be doing, that they wouldn't have done in a million years, but they're doing it. There's a great spirit going on right now in the country. So you want to, yes, please.
Dr. Fauci, you've said you like being accused of overreacting